So please, Erica.
Okay, so the study was in-home virtual reality video games and telerehabilitation in adolescents with hemiplegic cerebral palsy. So overall, there's a lack of accessibility in occupational therapy, especially for adolescents. A lot of the insurance programs tend to only pay for it up to a certain age. So by the time they get to the adolescents, it's not as paid for. Um, In terms of this, there's also a lack of accessibility within rural areas for all sorts of therapy. If you live in a rural area, it's harder to access care. But also in terms of a lot of the virtual reality studies have been people visiting homes, bringing the virtual reality, whereas this study potentially could have it there already. So overall, there's impaired hand function. So this is specifically looking at um, upper extremity hand function that can also lead to decreased bone density in hemiplegic CP. And there's also a lack of research in those with different comorbidities, such as epilepsy. So looking for games that don't have stuff that could trigger that epilepsy. So the objective of this study was to see if a virtual reality home-based study could improve hand function, improve bone health, and change alterations in motor circuitry um, through this. So the study was a 3-month pilot study, and it, like I said before, was home-based rehab that was connected to the hospital that was doing it and school that made the video games, and it was 3 adolescents with severe hemiplegic CP. So
Hmm.
the 3 adolescents were 13 to 15 years old. All 3 of them had severe right hemiplegic CP. So subject 1 is A in this image, subject 2 is B, and subject 3 is C. Subjects 1 and 3 had perinatal strokes, both in their left middle cerebral artery. And they both also had a prior medical history of seizures. They were both medication managed for the seizures and in remission for the seizures. But as you can see in both A and C image, that atrophy of the left side of the brain due to this left MCA stroke. So subject 2 had intraventricular hemorrhage due to as a complication to as of premature birth. Um, and you can also see that atrophy within that left hemisphere. So all 3 of them had a prior medical history of tendon surgery, as well as Botox injections for their spasticity. Where for the study, all 3 of them didn't have Botox 6 months before. And all 3 of them didn't have any OT at the time of the study. They all presented similarly with mere movements on the opposite side and generalized weakness. So this is a look at the actual game. It used a PlayStation 3 and this glove, this Ultra glove, you can't see it very well, but it's what this image is pointing to, this black glove here. This glove was able to sense the movement and put them onto the screen, giving the virtual reality component. A goal was for each of them to practice these games for 30 minutes a day, 5 days a week. Um, and I'll talk more about the games. So all the games involved finger flexion extension or thumb movements, and they were given a points-based system based on either if the game was for degrees or speed and the difficulty. And it also included that avatar of the hand, which allows for that component of seeing the hand to get feedback to know how to movement. And also, if they moved their finger a little bit on the hand, it would move it all the way. So it also allows for that increased functionality and freedom of movement. So there was 2 games that were played, the sliders game and the chase away a butterfly game. The sliders game is what you can see in this image here. It was to increase range of motion. So you would have to move with each finger the box away to try to build the image up.
Mhm.
So you would like reach up and you'd have to use a specific finger for each one to fully extend your fingers. The other game was a chase away a butterfly game focused on speed, similar to the Pop Bubbles game where they were reaching quickly extending their fingers to reach for the butterflies. So instead of the arm, it's focused on the fingers. So in terms of results, the time practiced, subject one practiced 60 days, 20 minutes a day, so pretty close to that goal of 30 minutes a day. Subject two practiced 67 days, 22 minutes a day. And then subject three experienced some technical difficulties. And once they were repaired, they were able to practice in total 36 days with 21 minutes a day. So that's about half the other two subjects. So we'll explore that more in the other specific results. So to measure their grip and their overall hand function, they used a dynamometer and pentameter to get the actual measurements of how strong their grips have changed. And they also used two motor tests. So they got baseline measurements a week before they started, in the range of a week before, and then other measurements afterwards. And the gray indicates changes that occurred. Um, Not a lot of these changes were significant, as significant as seen through the cross next to them. But in terms of grip, there was changes in all of their grip, but not in the pinch grip or lateral pinch grip. So it mainly just focused on overall grip. And then in the Brunski's Oystries test of motor proficiency, there was no changes at all, so they just didn't like involve that in the table. They focused more on the Jebsen's hand function test, where they were able to see some changes in tasks such as writing, turning pages, lifting objects, and feeding themselves. And as you can see, there was some changes with almost with all the patients. So in terms of range of motion, the glove was actually able to track the range of motion throughout the period. This came with some limitations because there was like no standardized like measurement throughout it all. It was just like seeing how it moved and potentially the glove wouldn't be on the same way the next time. So it was just trying to compare them from time to time. So each measurement was from a session, and they calculated a session by multiple games played in one sitting period of a time. So, as if you might have recalled me talking about it before, most of them had 60, 67 sessions, yet you see on here for like C and D, so this patient two had 100 sessions here. That means they took a break and came back to it. Um, so A and B is subject one's thumb range of motion and B is forefinger range of motion. Overall, there was an increase in the range of motion for subject one. Subject B didn't see much of an increase for either thumb or finger, but they were able to see an increase in some of the other fingers. You can see thumb had some increase, but not so much for the pointer finger. And then subject three had an increase in both of them. Overall, in all the fingers, which aren't all shown here, was subject one and three had 4 out of 5 of their fingers improve, whereas subject two um, had not as many fingers. Again, I'll go over this in limitations. Um, these were just taken from the glove, so it was hard to really standardize over time. So the other measurement they looked at was overall bone health. Using an X-ray, there was some increase in the bone density of subject one and just one and two. And then the fMRIs, where they were looking at spatial activation. So you can see to the right, in subject one, there was a little bit of an increase within the primary motor cortex, so there's a little more activation. And then the posterior view, you can see the activation increase even more on this left side. In subject two, there was more of increase within the primary motor cortex on both sides, and then a huge increase within the cerebellum from this posterior view. Huge is relative. When we're doing fMRI studies, they're standardizing them, and there's a way they do analysis that I don't totally understand. That is what's looking at these results. I'll also talk about in the limitations how they weren't able to standardize these to the actual activity because they didn't take video analysis of them. So this is just a general look at how the spatial organization has changed. Further research will be needed to fully understand what these changes are, how they relate to the actual movement, but there is some clear increase in overall spatial activation. And then subject 3, you can also see that increase within that primary motor, the primary motor cortex area and within that cerebellum. So I just put 2 main discussion points that I'll go into more detail and we can also talk about. There is potential for this to be beneficial for those who practice regularly. It could increase the accessibility, but of course, with any technology, as we know within our cities, there is always technology issues. So the goal of having it in a distance setting means we're not there to help with the technology issues right away. But hopefully with improvements in technology, that'll get better. And there was a lot of limitations to this. As it is a pilot study, of course, there's going to be a small amount of numbers. There was a lot of technical issues both within the program. The games were actually made for adults for CP that they use the same games. And the gloves, they designed them specifically for their hands because the gloves were also designed for that adult CP, but they weren't designed specifically for spastic hands. So there was limitation and how much you can move it or how it supported the hand. And so a future direction would be looking to design a better glove to see. I think it was cool how the glove was used and could be used for range of motion, but there was a lot of limitations in it. The motivation was low amongst all 3 of the participants. I think I would have liked to see some of those tests that we use about how much they enjoyed the games because they just wrote motivation was low when they were talking about it. So it would be nice to see what exactly about it made it low. I assume it was because there was only 2 games and the games, you're playing the 2 games every day for 30 minutes. And so they're slower moving games than other games may be. So just doing this for long term, looking at different games might be more beneficial. And overall, there was some bias because the occupational therapist collecting the data, of course, knew that everyone was trying to improve these aspects. And then, like I talked about before, the range of motion through the glove was not standardized. It also didn't have any wrist motion recorded, so any movement of the wrist could also have impacted the fingers. So those values and overall tracking could throw off the results. And also, like I alluded to before, is there was no video imaging to record the task while the fMRI was recording, so there was no way to correlate whether the how the task related to the actual spatial distribution. So there's lots of directions the study can go in terms of all of these points, but there is good potential of using VR as a way to practice and improve these range of motion, specifically in fingers, and we can relate it back to what we're doing with the upper extremity in a similar way. So that was the end of my presentation. I really just wanted to try to ask a question about how everybody could think it could also be improved and how it could be related to us trying to improve upper extremity compared to finger strength and range of motion.
Great job, Erica.